Hello, my name is Vince Burke. I have my doctorate in physical therapy and I'm also a performance trainer. I've been doing orthopedic sports medicine for about 32 years or so. Today I got a phone call from a friend of ours who's been a previous patient, and she's a community friend of ours, Ali, and this is her son Dylan, who's been here some time ago for some strength and conditioning, but then all of a sudden he just wanted to focus on baseball. She called me today and says, you know, I'd like you to examine my son on his elbow. He's been having some pain. So I'm just going to bring you through a little history. He grew about 4 inches this year. He just turned 12 about 3 weeks ago. In December, he started to do some skill pitching on a Tuesday and Thursday. Each of those days with a facility in Bergen County, he was pitching 100 pitches each day. That brought him, and he was going there for about 2 or 3 months. In between, he was not doing any strength and conditioning at all. He was just working on his skill. After that, he then started to do some Little League and travel baseball on top of the skill stuff. So come March, while he was having some pitching lessons, he was having some pain and discomfort in his elbow. But like anyone else, most kids, they think it's normal. If the coaches don't recognize that as to even ask, hey, how's your elbow doing? They're not going to do it. At the end of the day, if mom and dad is paying for lessons, and that's the coaches or instructions or their facility's livelihood, I can guarantee they're not going to explore what the volume is best for the child. At the end of the day, they're doing it for income. And we all have to remember that as parents, they're making a living on your child's pitching. Moving forward, he was having the pain, and then he started to do some skill stuff with the team. So Tuesday, 100 pitches, Thursday, 100 pitches, and then on the weekends, he started in March and April, he started to pitch with the club team or travel team. Each of those games, he would have 2 or 3 innings. I asked the question, how many pitches did he start before the game started? And he said 20. Then in between each inning, another 10. And then each inning, 15 to 20. So now it's 50 to 60 pitches each day, Saturday and Sunday. That's 120 pitches on top of the 100 on Tuesday and 100 on Thursday. So now you're talking well over 300-400 pitches. Then he would have practice. Well, the practice happened before the games even start. So I'd even ask Dylan how many throws he do, long toss. If he's in the outfield, he'd say 20. And short toss. So now all of a sudden we're at a high volume in the 400, 500 throws a week. His arm is 11 years old. He's only been walking on the earth for 9 years. That's a lot of volume for the growth plate. A lot of volume for the musculoskeletal system. Even though Dylan grew 4 inches, stand up. He looks like he could handle it. He actually looks like a freshman. But until he smiles, he has braces on. So the thing is that just because an athlete looks big, acts big, it doesn't mean that the musculoskeletal system is big. So now all of a sudden we're facing micro trauma, and then when you have an injury and we push through it, now we have macro trauma. So he went to the doctor midway after the winter, and he took a film of the elbow. And it turns out that he has a stress fracture at the growth plate where it came off. He then shut things down for about a month, and he was asymptomatic. The doctor said, okay, you're good. And then he resumed some pitching stuff, and then he started to have pain again. So what he did was, he went for an MRI. Well, the MRI revealed a lot of irritation at the medial area of the elbow, at the growth plate, and also at the nerves. He was having some numbness and some tingling. So now all of a sudden, it becomes a mess. But I know he wants to pitch, and I know mom wants him to pitch, and he's doing great. The problem is that he destroyed his elbow at 11 and 12 years old. So what I like to do is just go over a little bit of my exam. So come on over here, Mike. So even if you look at him like this is what's called the carrying angle. On here, this angle here, this is pretty much bulbous. This angle, okay, because of that much volume, is sticking out quite a bit, okay? So he has an increased carrying angle. So we're seeing structural issues going on at 11 years old, okay? So that's one issue. He has severe tenderness all along here, okay? And he has some joint pain. So the ligaments here are irritated. Okay, he has a stress fracture in here and then back in here. So on this here, okay, he has some irritation, some stress fracture here, and then of course he has stress fracture on the inside here. These ligaments here, which hold the bones together, are irritated. And then there's a nerve, hold your hand out here, there's a nerve that comes around here, right, comes down here, and that would be the ulnar nerve. Sometimes that even gets entrapped. So I have some athletes who are 13, 14 that have Tommy John procedure. A lot of them could be avoided if we just pay attention to volume. So my prescription for him is not to pitch for 2 years. Because at that point, he could work on strength, conditioning, and other skill sets of baseball. He'll be well-rounded. By the time he's in high school, he'll be about 6'1", 6'2", okay? And then we can go from there and reassess things. The other thing is that easily you could tell that he has what's called a GERD in his shoulder. Glenohumeral internal rotation deficit. And you say, what is that? Well, because you're gonna lay on your back here. So if I take his elbow like this and I place this down like this and put this down here, right? Okay, I can't even bring this down at all. Okay, and then I go on this side. And of course, you're righty, right? And of course he's righty, but I'm gonna do the same thing and down like this. So the joint mobility is quite different, but a lot of it has to do with his pain in the back here. So if I go like this, right, and palpate all in here, and that hurts. Are you smiling? That hurts. Okay, and then over here, okay, because he pitches and this leg is planted, comes across, okay, also he's very, very tight in the hip. So on the left, he has what's called a positive Faber fracture, neuritis, overuse, stretched ligaments, and the GERD. You're up. So then I always assess at this level, you have to appreciate that there's no way in hell that he has proper form and technique on every pitch. Not even 75% of the pitches. So what I do is a little assessment. It's called an assessment to determine if you're a chucker or a thrower. A chucker or a thrower. A chucker uses a lot of their arm, and a thrower uses their hips and core. So you're gonna lay on your back. So I always say, if any athlete could do 3 of these, first of all, I'll train them for free for a year, okay? But in his case, I'm just gonna assess the front and the sides. So you're gonna bend your elbows up like this. So he needs to keep his elbows in contact with his knee while I roll him. And roll it. And up in here. Up in here. That's good. And up. Don't kick me, too. Don't kick me. Elbows up here. Elbows up here. And he's struggling just with that. But that's the front. And now I'm going to get the side. So you're going to come like this. This elbow's here. Both hands here. And now, pull up. Pull, 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 pull. And if you notice, he can't even do 1 rep. That means the pitching, whoever's pitching, they need to be able to instruct the kids on proper exercises that could handle the volume that they're prescribing for these kids. So at the end of the day, he's going to be here for physical therapy, and he's going to be here for core strength and conditioning. He's going to be here for balance training, and he's going to learn how to self-care and monitor his elbow. And that's important as he ascends the athletic ladder, because I'm finding that if we don't instill education to the child and the parents and the family, you can't rely on that at the next level, because there's too many kids to monitor. So we have to empower them with the proper exercises to prevent injury from happening. Thank you.